Good morning, and thank you for joining the New England Nursing Home Quality Care Collaborative. My name is Sarah Dorenick, and this is part one of the two-part webinar series, QAPI Process Plan Outcomes. Today we will be hearing from Sandy Fitzler and Florence Johnson. Now, before introducing our speakers, I'm going to quickly review a few housekeeping items. This webinar will be recorded, and the presentation will be available within a few business days. The phone lines will be on mute for the duration of the presentation, and we ask that you please do not put your line on hold. If you have a question at any point throughout the presentation, please enter it in the chat panel to the right of your screen. Please make sure to send your comments to all participants, as we will be monitoring and responding to questions and comments in chat. We will also have plenty of time for questions at the end of the presentation. Lastly, if you find that the presentation is a little cut off, please use the plus or minus icons in the top right of the presentation window to adjust your screen accordingly. Now let's get started with today's presentation. I would like to introduce to you Sandy Fitzler. Sandy?
Good morning, everyone. I'm Sandy Fitzler, and I'm the Senior Program Coordinator for the New England QIN-QIO in Massachusetts. And I'm going to be speaking the first half of this webinar, and then coming in after me is Florence Johnson, and she's the Consulting Manager for the New England QIN-QIO out of Connecticut.
That was before you got the directive.
No, because Jay and Jefferson called.
If you have not muted your line, please make sure you mute it, because we do hear some conversations in the background.
Okay, so what is QAPI? And I'm sure you all know what it means. It means Quality Assurance and Performance Improvement. QAPI is a systematic, data-driven approach to continuously improving quality. Why continuously? Because as standards are consistently achieved, they become the normal expectation. Thus, to achieve a quality service or product that is state-of-the-art, improvement is always needed. So in essence, quality is a moving target. So I want to give you some examples of that. When we look just at regular products like the cars with GPS systems, that used to be a quality car came with a GPS system. Now, many cars come with them, and if it's not in your car, if you don't have them put in your car, people have GPS systems. So what is a quality car? It's one that now comes with upgrades like a backup camera or a turn camera. Or if you look at a TV, a flat screen TV, that's the quality TV. If you go into a store to buy a TV, that's all you see today. That's become the standard. So now your quality TV is a smart TV. If we bring this whole concept of quality as a moving target down to the nursing home, let's look at a nursing home service like we don't use restraints anymore. We've been working on it for years. Everyone has really done a good job at that. That has become an expectation. So a quality service is one that focuses on improving and restoring function, strength, and balance. And if we look at nursing home products that have changed over the years, we used to use incontinence pads. Now they become good-looking underwear, and they do not lead to skin breakdown. So as you can see, all new quality services and products become the standard over time. So let's talk a little bit about the QAPI law. Everyone knows that it has been mandated under the Affordable Care Act. And nursing facilities are required to submit their QAPI plan 1 year from the final rule when it was posted. And it was posted on 11/28/2016. That means you're going to have to do something with that by this November. The Act includes an additional part of it that relates to infection control program and the QAA Committee, and it relates to preventing, identifying, investigating, and controlling infections and requires incorporation of an antibiotic stewardship program. The Affordable Care Act also adds the infection preventionist to the QI committee. What we are currently hearing is that there is still conjecture of how much information will be needed. You all will need to share with surveyors in November in regards to your QAPI plan. But hopefully we'll get more insight into that when the interpretive guidance is released, and that is expected out this summer. The existing quality program for nursing homes is QAA, Quality Assessment and Insurance, and that stays there. It's still ongoing. The only thing that the Affordable Care Act did was add the infection preventionist, as I mentioned, and that person becomes a member of the quality committee. The reason why the Affordable Care Act added additional quality requirements is that QAA does not specifically engage the culture of the organization. It does not promote information exchange, and it does not stress the need to continuously strive for quality improvement. There are 5 strategic elements that are needed to build your framework for a successful and sustaining quality program, and I'm going to talk briefly about all 5. Element 1 is design and scope. Your QAPI program needs to be ongoing, comprehensive, and complement your facility's mission and vision statement. Your vision statement reflects your future state of practice, or what you intend to be. Your mission statement defines your facility's overall function, what you are intending to accomplish. Your mission statement should address 3 questions. Number 1, what do you do? That's your services. Number 2, who do you do it for? That's your customers. And number 3, if you do your job right, what do you expect will happen? And that is your outcomes. I have been in nursing facilities across the country, and when I go in, I always look for the vision and the mission statement. I see it nicely framed and hanging in everybody's lobby. This is a good time when you're putting together your QAPI program to take them down, dust them off. Make sure that your quality program is consistent with your facility's vision and mission. And it's also an opportunity to look at those statements to see if they need updating. In addition to that, your design and scope of your quality program needs to include all staff and focus on clinical care, resident choice, and quality of life. Your program needs to be data-driven with established goals, and your QAPI program needs to be described in writing. Element 2 is governance and leadership. You need to make sure that someone is responsible for QAPI. This could be your QI committee, or I know some of you have a QAPI committee. Whatever one of the quality committees you choose, they have to be responsible. Somebody needs to be responsible for QAPI. Staff, residents, families need to be given the opportunity to address your quality committee and or participate in quality improvement projects, your PIP. Facility leadership via your quality committee must ensure that the PIP staff are given the time to participate, like attending meetings or if they have to go to training, or the resources that they need to get the job done, like to do staff training, maybe to buy equipment. Communication is key. Everyone needs to be kept connected, and you can do this via shift reports, newsletters, postings, mailings, storyboards, events. You can communicate and you can share informative information with everyone, but you can make it fun as well. A few years ago, I happened to be in a Massachusetts facility where they were doing a day storyboard event with a focus on dementia care. So they had departments develop storyboards about dementia and Alzheimer's disease, and they held a social event.
Morgan, could you please mute all lines? We can hear some background noise.
The leader has unmuted your line.
Okay. So anyway,
The leader has muted your line. To unmute your line, press pound 6.
Okay. Can everyone? All right. I'm on again.
Yep, we can hear you, Sandy.
Thank you. So this facility had a major event. It was going to be a festive event where they put all these storyboards in one of their larger areas, and they invited everyone to attend throughout the course of the day. That would be all staff come and learn about dementia and Alzheimer's disease. All residents were invited. Any visitors to the facility were invited to attend. And since the Alzheimer's Association color is purple, everyone was asked to don something purple, whether it would be in a sweater or clothing or jewelry. And I'm going to tell you, I was there, and this was quite fun, and I learned a lot. Element 3, feedback, data systems, and monitoring. This element pertains to setting performance targets and monitoring progress. Having a feedback system to communicate quality program results is needed. Data that facilities can use, and I've seen a lot of facilities use their nursing home quality measures. You can also use your CASPER reports. You can use incident reports. However, other data may be needed and you don't already have that in a planned report, and it's perfectly fine for you to develop a data collection and monitoring system on your own. For example, again, if one of your issues is to focus on dementia, then you might want to be keeping behavior logs so you can capture the data on the logs. Element 4 is performance improvement projects, your PIPs. Your quality committee identifies the quality issues. Perhaps through monitoring your QMs or based on survey results, or perhaps you've received complaints from staff, residents, families, and the referring hospitals. Whatever way you identify your problem, you have a whole lot of different methods that this can come into you. Your quality committee then decides if a PIP is warranted and the nexus of the problem. So what do I mean by the nexus of the problem? Do you have a facility-wide problem? Or is your problem isolated to one or two wings of your facility? Or is it just a couple of residents? It makes a big difference to identify where the problem is located in order for your PIP to be effective. It is the quality committee that works with the PIP in identifying and agreeing to the timelines, how long you're going to run this PIP, resource needs, your project goals, how the quality plan will be communicated to others, and support how quality efforts will be incorporated into existing assignments. Like if you need to have staff keep behavior logs, then they need to be recognized that they need time to do this. Element 5 is system analysis and system action. And here is where you're going to determine root cause, because root cause is, we have a structured method used to determine the underlying causes of the problem. Now, some problems are obvious, while others are not, and the team needs to dig deeper. Example of a root cause method can include fishbone charting, and I have been in a number of facilities, and some of them are using fishbone charting. Other facilities will bring staff together, and they all put forth their opinion of probable cause or causes. I call this approach a learning circle method. You also want to be clear with everyone that you are using a problem-solving method that includes the following steps. Number one, you want to do an assessment to identify the problem causes. 2, you're going to develop a plan to address the problem. 3, you're going to implement the plan. And then 4, you're going to evaluate the impact of that plan, was it successful or not. And we refer to this method as Plan, Do, Study, Act, PDSA. I'm sure you all are familiar with PDSA. For the nurses out there, this is the same thing as the nursing process. For the other medical professionals, they might have learned this process through the medical process or the scientific process. It is all the same. The steps are all the same. So what is the role of leadership in the QI committee? They will decide on the data to use for identification and monitoring of results. If you are reporting to a board, then that committee will gain board support for your quality effort. And this is the most usually associated with the capital expense if it is needed. Identifying staff and others to be involved in the quality project. Making sure that individuals are not punished for errors. We want to stop the fear of communicating upward. And developing your quality charter and your PIP process. So what is a quality program charter? A charter is a formal document that defines your quality function and lays down your rules of conduct. It is a written plan. This is a QAPI requirement outlining how you will address quality. The charter clearly establishes the goals, scope, timing, and team roles and responsibilities for quality improvement. It is developed by leadership and the quality committee, and the charter helps the team stay focused. We have put together 10 questions that you should look at to put into your QAPI charter. Remember, this is a higher level document on your quality program. It shows what you are currently addressing and your performance improvement goals. You may have 1, you may have 2, you may have 3. It shows how you communicate quality issues to residents and families. Now you see the first 4 questions here that you need to address put in your charter, and here's the remaining of the questions. It is important for your facility to put your facility name on your charter and date on your charter. And the charter can be updated as needed. For example, if you have one of the goals on your charter, it might be you're going after falls with injury. And you wanted to achieve your goal, and you wanted to do that in 3 months, but you find in 3 months you have not achieved that goal yet. That's okay. That's an expectation. All you do is say, okay, we're going to need another 3 months to get there. You change the goal target date, and you change the date of your charter. So it's always updated that way. The quality charter may be one of the documents required to be shared on survey starting in November. And at the end of this presentation, we do have a slide where you can get links. We have a QAPI program package where you can find the quality charter and questions. Plus, we have completed an example of a charter. So you can use this either as your own to add in your information, or you can use it, the questions here, to help you put together your own charter. So let's do a polling question. How has your team developed a PIP? Has your team developed a PIP for an improvement project? Yes or no? WebEx, please open the polling now. And this might take a few minutes.
Jennifer, can you open the poll, please? You should see the polling question now on your screen. Once you've selected your answer, please be sure to hit the submit button at the bottom of the box. Thank you.
It takes a minute or so, but the results will come and you all will see it.
While we're waiting for the poll to
Unmuted.
show the results, if you want to share any PIPs that you have going on right now, the goals, any progress, share with us in chat. We'll just move on and see if the polling results show up on the next.
I suspect that, we do have a yes, and we can see, and I was going to say, I suspect that many of you are already doing PIPs because I have seen them, so I know that you're working on it. So let's talk about PIPs, performance improvement projects. What the PIP does in writing, and it's the quality project that you are currently working on, so you want to name it. It identifies the people who are working on the issue, and my recommendation is to name them, and let me tell you why. If you have volunteered or you've been selected to be on the PIP, if you don't have the person's name on it, nobody is accountable. Not only that, the supervisor doesn't know that this particular individual is participating on a PIP and they need to be given some consideration and extra time to do it. So I do recommend that you name the individual on the PIP. It identifies supplies that will be needed to help solve the problem, like lists or training supplies. It identifies the PIP meeting schedule. Example, is your PIP team going to meet once a week or once a month, the day and the time? Or perhaps you're just going to handle it through 5-minute stand-ups and you know what works best for your facility. You want to identify the data sources that will be used to identify and monitor the problem, like your QMs, your keys, resident level report, incident reports, event logs, stop and watch reports. All these things can be used. It names the person responsible for data review and how often the review is done. And it names the person who will prepare and present the project results. And most often, this is the same person for the last two. It names the protocol or procedure that addresses your issue. So if your PIP relates to antipsychotic medication use, and you have a procedure for that, you're going to either say, see attach, and attach it to your PIP so everyone knows that you've already got a procedure on this. Or if it's just a few lines, you might want to write in a few lines of what that procedure is that you're following. It identifies the problem-solving model that the team is using, and most commonly, as I said before, it's PDSA, and identifies how the root cause of the problem was identified. Fishbone charting, learning circle discussion, or other. This is important because it's okay if your PIP does not reach its mark the first time around. You might have come close in finding the issue, the cause of the issue, but you might have missed it. in which case you do have to go back, relook at the information that you gathered, how you gathered it, and then move on to maybe the next clause that you think is related to this. Again, at the end of the presentation, we've provided in the QAPI packet, you can find the PIP outline with all these issues here, and we've given you a completed PIP as well. It does not have to be lengthy. You can pull it in bullet form, and this is a way to get going, or you can use it as for information purposes only if you want to put together your own PIP and use that information in your own PIP. So now I am going to turn this over to Florence. And hold on a second.
All right, thank you, Sandy. She's trying to get in control of the slides. Just want to thank you for defining exactly what QAPI is. And I will talk now about your teams and your committee and what it actually means to put the team together. So quality improvement responsibilities. You have two sets of entities who are responsible for your QAPI. You have your QI committee, you have your PIP team. So you're probably asking, can I use my QI committee to act as my PIP team? Those two teams, the committee and the team actually have two totally different functions. And the function and the composition of each team greatly differ, and I will discuss this a little bit further. But first, I have a polling question for you. Does your facility currently have an established QAPI committee? Jennifer, could you open the polling question, please? All right, so there are your options, yes or no, and don't forget to hit submit when you're done doing that. And while we're waiting for people to make their decisions, I have to just piggyback what Sandy said previously. If you have not started your QAPI plan or do not have walls around it, you just need to get started. As long as you have something in the works, it's easier to fix it than to not be started at all. All right. A few more seconds, and then we'll have our results. All right. Oh, wow, this is awesome. 105 out of 178 actually have a committee. The 63 that didn't answer, I'm hoping that meant that you forgot to hit submit. And the 10 of you that have not established one, hopefully after this webinar, you will feel more educated and empowered to start your committee. Thank you so much. So what is a committee? The textbook definition for committee is a group of individuals whose primary pursuit is the betterment of their own needs over those of the group. And we know just by listening to Sandy that that's not what a committee for QAPI should focus on. And because of the fact that most committee members are there for their own betterment, Robert's Rule was developed, and what it does is it helps the committee to focus on the work that needs to be done, and it guides the way that voting occurs. And it also makes sure that everyone at the table has a voice, and their ideas can be heard. The final rule mandates that facilities must include the DNS, the administrator, the physician, minimally as part of their committee. We are saying that you should also include other members, such as your IP, your infection preventionists, maybe some nurse managers or charge nurses, but your committee should really reflect your facility. It's important that leadership, as part of the committee, encourages everyone at every level to have their voices be heard and be allowed to give input in meetings and ideas as far as your QAPI plan goes. So what is a team? A team has 3 or more people. There's a common accountability. There's a reason for them to meet. They have a common goal. Those goals are well documented. They're spoken. Anytime a team meets, you should always review what your goal is and what your purpose is. Otherwise, you're just having a meeting just to meet. The team also needs to be interdependent. So yes, I can do my own thing, but when we come together as a team, we need to work together, not just individually, but as a unit. And I mean, there are projects that you'll have that will require that the team invite the ADNS, the DNS, and the administrator to the meetings because it involves maybe money to be spent. It might mean that there's a family issue with communication, something that leadership has to be the one to resolve it. But most of the time, your team should really be those who are on the foreground of the work. It's the people that are actually doing the work because they understand what needs to happen to have the change occur. So, for instance, you're looking at reducing antipsychotic medications. It's going to be the frontline staff, the nurse, the CNAs, as well as maybe your behavioral health people who will actually drive this change because they understand the residents' behavior and the triggers that sets them off. The DNS will not have so much involvement in that because they're not working with the resident on a daily basis. So how do you address quality issues? A specific issue-based team, which I just talked about with the antipsychotic medication reduction, is best suited to address a quality issue rather than the committee because the committee is actually kind of like the president, but you want the workforces who understand exactly what's going on. However, it is, again, the role of the committee to decide, to help to decide and build the PIP team. So they, the director and the ADNS and the administrator may have suggestions on who should be invited to the team. And ultimately, once those people are gathered, they then can filter each other out to say, well, I'm not really so much involved in antipsychotic medication use, so I'm going to have to excuse myself from this particular committee. Now, particular team. Now, please remember as you're working through your QAPI plans and your PIPs, more is not better. It's actually better to have 1 or 2 projects that you can afford to give the time, the resources, and the energy to and do it well and be able to really use the data to drive what you're doing versus having 20 projects that you don't really understand how it's moving along and how it's affecting the quality in your building. So the QAPI committee is actually the overseer, and the performance improvement team is made up of, again, people who are directly affected in the change. The committee, the QAPI team, should also include your residents and your families, which is what QAPI is all about. It's all about involving and hearing the voice of everyone in the building, not just the people who work there, but also the people who live and visit. as you're going along and making decisions about what should be done and how it should be done, let's talk about why projects fail or decisions fail. One of the reasons is that you may have chosen a leader who's not ready to be a leader. So sometimes we look at the people who are most boisterous as, oh, that person should be the leader. But then that person might be one that likes to do everything themselves and not necessarily involve the team. That's not good leadership. You want a leader who will verbalize what the work is that needs to be done and be open to have others help get that work done. There might be faulty problem solving. So maybe when you're not communicating with each other properly, maybe the understanding isn't there about what the goal is. And this is why Sandy said it's very important that you put everything in writing. It's also very important that you have your norms, your rules for engagement when you have these meetings. And then when you do have a problem-solving issue, Sandy said you're doing your PDSA cycle, stop if it's not working the way you want it to work and evaluate what you're doing. It's very important that you put that on paper. What happened that made this not work well so you don't repeat that same mistake again. You may have a team that doesn't work well. You don't want a team that only one person is controlling. That's not a team. You want what we call a snowflake model where everyone is bought in and interrelated and working like a wheel. Everyone should have a mental and visual understanding of what the work is about. You don't want people who are not committed. If someone tells you up front that they cannot commit, do not force them to be on the team. It will not work for you. And the reason that you will have lots of commitment most of the time is that there's no buy-in in the beginning because people aren't told exactly what the commitment is. They're not told what the work is all about. They're usually told, oh, just come with me. I think you'll be good at this. But to get buy-in, you need to explain to people what you're doing. I'll give you an example. I was at a facility a couple years ago, and they were just starting to roll out SBAR for documentation. And the educator came in and said to them, we're starting this new documentation system, so I'm putting it in the chart, and then we will no longer do narrative. And the staff kept asking him, well, why do we want to do this, and what is it? He was unable to verbally explain to them what SBAR was and why the facility was switching to that. They actually had a conversation with him for 10 minutes, and he was not able to explain it. And I thought that was a missed opportunity for him to be able to explain what SBAR is and why you're doing it, which in the long run is better quality of care for your residents because you're able to communicate what you need to the doctor and tell the full story. So there was no buy-in with that SBAR. This is why it's important to have a person running the team who has a thorough understanding of what the goals are. So how should decisions be made? We should have a consensus, which means that everybody agrees with what the decision is. If you have some outliers, it's important to hear those people out to see if there's any way that you can come to a meeting of the minds. The decision is better when everyone has something to contribute and feel like they've been heard. Then the team as a whole comes up with a solution that they can go out and then speak on it and not feel like I was made to do this or I wasn't part of the decision-making process. And the biggest thing to take away from this is that the decision is made by the team and not just one person. And it's important that leadership supports the team as necessary to make sure the QAPI project gets completed. So key takeaways from the QI committee. It provides QAPI leadership and governance. It develops the QAPI program and charter. It identifies the quality concerns that need to be improved. It selects or helps to select the PIP team members. It selects or helps to select the PIP facilitator. And a facilitator is a person who is part of the team, but is also the one that basically is kind of like the gatekeeper. Make sure that people don't go off track, make sure that we're staying within our time, and make sure that the focus remains on what the project is about. They could also be your data person. They could be the one that brings the data and makes sure that the data is reviewed at every meeting. The QI committee helps to facilitate the PIP decisions, and if there's any capital needs, the funding that goes with any global improvement that needs to be done. So then the key takeaways for the PIP team. The PIP team decides what project through consensus. They use data sources to monitor and to drive the results. You always have to use data when you're doing quality improvement. They determine how often the team meets. They decide team members, who's going to be added, who's going to sit out for the next project. They select facilitator and the data capture, just as I said previously. They ensure that any capital requests are identified and shared with the QI committee. You should also have someone from the PIP team that bridges with the committee, because you need to have someone that's going to be able to be the speaker that comes back to the committee to report on what's being done and to make your request. Now, the PIP team, as I said before, should include your residents and your families. So again, I have a polling question for you. Does your quality improvement or QAPI committee also serve as your PIP team? Oh, up for you. Yes or no, please hit submit when you're done. And while we're waiting for the responses, please remember that you don't need to build a brand new team or a committee. If you have a committee that's working already, you can use that committee. But we don't want every committee, every team to have the exact same members. So your committees and your team especially should change a little based on whatever issue you are addressing at the time. So your committee for for antipsychotic reduction will look totally different than the team that's addressing, say, an environmental issue or laundry or maybe even dietary. So your teams could change depending on what issue you are addressing. Okay, it has closed. We're just waiting for the response. I guess I will move on because it's not showing up for me. Oh, there it is. So 52 out of 177 says they are using the exact same team. So, you know, it's something to think about. As I said, your team should look different based on whatever activity you are working on. So now let's talk about root cause analysis, RCA. Andy talked about PDSA cycles, which is, little tests of change, doing it for a couple of weeks and then coming back and addressing it. Root cause analysis is a purposeful, structured way to identify any undesired outcome. So you're going along, you're doing your project the way you mapped it out, and all of a sudden something happened that was not predicted, it wasn't part of the process. So you want to stop and you want to look at what happened. It is a way to determine if there's anything that you should have done differently. Maybe at the end of it, you find out that, oh, this was a natural break, and we should have known to put that in, but we didn't. It's what we call in quality improvement, we do that asking 5 whys. Why did that happen? Why did that not happen? Why did that happen? Until you can't ask any more whys. It is a way of identifying, again, breakdowns in the system that you did not anticipate. I should have asked a polling question here to find out how many of you are doing root cause analysis, but I'll catch you next time. So here I have homework for you, and I hope that you don't find this to be painful. It's something that goes along well with what we're talking about today. If you don't already have a QAPI committee, I want you to begin to map one out. If you have one already, based on our discussion today, revisit that committee to see if it's going to serve your purpose. If you don't have a charter, because I know a lot of times we visit facilities and they say, oh, we're doing QAPI, we just don't have it written down. Well, CMS wants it written down. State surveyors are going to be asking to see it, and they're not going to accept you just calling it off from the top of your head. So it has to be written down. So start to build your charter, and then start to discuss possible projects that you want to look at. Again, you don't want to make humongous work for yourself and look at 5 projects. Maybe it's one just to get your feet wet to see how it goes, and then you add more to it after. But this is your homework. We will be meeting again in a couple of weeks, and we'll talk about how you made out with this. So at this time, here are the links that Sandy talked about before where you can get more information about today's discussion. We have now an opportunity for you to ask questions, and I will hand this over to Sarah.
Thank you, Florence. At this time, we'll address any questions. To ask a question, please press #6 on your phone to unmute your line. Also, you can submit a question using the chat panel on the bottom right of your screen. The line is open. Just announce your name if you're joining us to ask a question. And while we wait for people to join on the phone to ask questions, I did receive a question in chat. It was a private question. Just make sure you send your questions to all participants so everybody can see them. Do we have to use the QAPI tools on the CMS website is the question. Sandy, do you want to answer that one?
They have put the tools up there for you all to look at. If you want to use them, that's fine. If you want to make your own, that is fine too. Until we see that interpretive guidance, I would suspect that you're not mandated to use their tools, but we will check when that comes out this summer. So use it just as guidance right now if you'd like, or the ones that we have for you as guidance, and go ahead and just develop your own.
We have a couple questions in chat. One comes from a few different people. How do we receive copies of the presentation slides? If you joined the webinar portion a little later, you wouldn't have seen the initial link that Morgan put in chat, so I did add the link again in chat for you to access a copy of the slides today. We have another question from Marissa. Is there a sample of a charter that we could see while drafting our own? Good question.
Our hope, this is Florence, our hope is to get a sample out to you with the thank you email that you'll be receiving to all participants.
Charter that's completed with bullet points, and we have the empty charter, so you can just lift up those questions and make your own charter. We have one as an example that's already completed that you can kind of look at as a guide. We've done the same thing for PIP as well.
And I will add a link to access that in chat just as soon as I pull it up. Do we have anyone on the line that has a question? All right, we have one more question in chat from Tara. The regulatory requirement is for a quarterly QAPI meeting, correct? And then the second question is there any type of regulation that requires monthly meetings for QI and or QAPI? Florence, would you like to answer this question?
The final rule does just require quarterly meetings. For me, as a suggestion, I would recommend as you're beginning to meet monthly because you want to make sure that your foundation is solid, and then as you move along, you can then move it to quarterly.
Thank you, Florence. Do we have any other questions on the phone? Okay, we have another question from Alan. What happens if the ACA is replaced? Florence, do you want to?
I can.
Sandy's going to reply to that one.
I have the very same question, Alan. Because there's a lot of conversation. We're going to replace and repeal, the Affordable Care Act, or Obamacare. So I went to the healthcare associations in Washington, D.C. to see if they knew anything more on this, and they really don't. What they told me is the sections pertaining to QAPI, ethics, compliance, and supporting suspicion of crime, none of that was on the block to be repealed. So that means it was only the Obamacare portion that is listed for repeal. So those other sections will continue. They will stay. Now, the second question I asked, well, do they stay out there without being attached to an existing law? And they really did not know. They said that at the national level, there's been a lot of discussion on this. Both long-term care associations have been meeting with CMS. They've had a lot of conversation, and people are just trying to figure it out. So we don't know what's going to happen yet if it is repealed. But I would say for now, those areas, and the QAPI was not cited as an area that would be repealed. So please go ahead and consider it a done deal.
Thank you, Sandy. We have another question. What does the training requirement effective communication mean, or what does it include? Florence, do you want to respond to that one?
I'm not understanding that question. Diane, are you able to unmute yourself and ask the question live, please?
Hi, thanks. Our question's in regard to... Hi. I our question is in regard to the new training requirements for CMS. That include an effective compliance and ethics program, abuse, resident rights. Well, one of those training requirements is called effective communication, but it has absolutely no clarification or additional information. So what kind of communication are we training our staff on? It's a little off topic, but I figure you might know something about the...
Is that related to the CDI work?
I don't know what CDI is.
Okay, so I know that CMS wants us to train nursing homes on Team Steps, which is a communication platform. So our 6 states will be rolling out the Team Steps communication education. I'm just not sure when it's starting. Sarah, do you have information on that?
It will be rolled out shortly.
And that wasn't mentioned in the regulation. You're telling me that's what the regulation is referring to, or do we have to wait until more clarification or what you call guidance comes out?
Yeah, that's what I'm feeling like, because I don't remember any information about training on education. I've read the summary of the guidance, and I don't remember seeing that. I know that in some of the work that...
Can I have your email, and I will send you the regulation,
Okay.
the training regulation that itemizes the specific training requirements. And it would be extremely helpful if you could just give us whatever you know.
Okay. I put my email in chat. So if you just email me that, Sandy and I can review it and get back to you.
Super. Thank you for your time.
Thank you.
Thanks, Florence. And we did provide that link to access the QAPI program packet on our website in chat. So make sure you check that out. And we can certainly address this question further during part 2 of this webinar once we get some more clarification on the specific question and we get the exact answer to provide to you. So keep a lookout during part 2, which will be exactly 2 weeks from today. Do we have anyone else on the line that has a question? Okay, great. Thank you all for your questions. We have a lot of learning sessions coming up in the next couple of months, as you can see from the list on this slide, including part 2 of this webinar series, which will include more time for discussion to answer your questions, as well as a presentation from a nursing facility here in New England. And their team will be taking the time to talk about a recent PIP that they implemented and will share strategies and best practices on how to have a successful PIP. We're also excited to announce that we'll be having 2 in-person learning sessions on pain management with Carol Curtis. She's a nationally recognized expert on pain management. Before we close out today's session, you will receive a follow-up email with a link to a very brief survey about today's webinar. We ask that you please complete it. This is very important. Your feedback can help us to improve these sessions and provide you with more meaningful programs. Also, within the next few business days, we will send out an email to everyone that contains links to both today's presentation and a recording of the webinar. We did want to make a quick shout out that the New England QIN-QIO is now on social media, so take a look for us on Facebook, YouTube, and LinkedIn. And we currently have a contest going on right now to enter for a chance to win 2 free entrance tickets to one of the Carol Curtis sessions in June. It's very easy to enter. All you have to do is find us on Facebook and like us. So this will conclude today's session. Don't forget to register for part 2 of this webinar series, which takes place on April 20th at 11 a.m. Thank you for attending and have a great